Long before penicillin changed medicine, garlic was one of the first and most trusted remedies people turned to when infection set in. Stick around and you'll hear how workers, soldiers, and early physicians used a clove of garlic the way we might reach for an antiseptic today, and why that actually made medical sense long before labs could explain it. Ancient Egyptians recorded garlic in medical scrolls and fed it to pyramid builders for strength and protection against illness. Hippocrates and later Roman writers like Pliny praised garlic for coughs, wounds, and stomach complaints. People chewed cloves, mashed them into poultices for cuts, and applied crushed garlic directly to sores. Practical, repeatable treatments passed down by healers and watched closely by early doctors who noted fewer putrid wounds and fevers in patients who received garlic remedies. The simple medical idea behind those practices is easy to follow. Crushing garlic releases a compound called allicin that interferes with bacterial cells. In plain terms, garlic can slow or kill some germs on contact, which explains why a topical smear or strong raw dose sometimes stopped an infection from getting worse in an era with no manufactured antibiotics. Those early observations mattered because antibiotics didn't exist, so people relied on what worked. Field surgeons and folk healers used garlic as a disinfectant, a wound dressing, and a preventive tonic. Records from bedside notes and herbal manuals repeatedly mention faster smelling, less inflamed wounds after garlic application, even if the dosage and results varied. Modern science has since confirmed garlic's antimicrobial properties in lab tests and small clinical studies. Allicin shows broad activity against bacteria and fungi, though potency, delivery, and safety differ from prescription antibiotics. The takeaway is clear and intriguing. Ancient healers discovered a real, testable effect, and their practical techniques still help us understand natural defenses against infection today. Why doctors use garlic for infection? When physicians and folk healers confronted festering wounds and fevers in an era without manufactured antibiotics, they turned repeatedly to pungent plants that seemed to slow decay and ease symptoms, and garlic was among the most prominent. Practitioners across Mediterranean, South Asian, and East Asian medical traditions recorded its use, eaten to bolster the system, crushed and applied to sores as a poultice, or infused into oils and dressings to rub into inflamed tissue. Doctors noted practical effects: reduced odor in wounds, slower putrefaction of tissues, and sometimes faster resolution of infected ulcers. Observations that encouraged continued reliance on the bulb in both household first aid and formal care. Crushing or chopping the cloves releases a sulfur-containing compound, allicin, which produces a sharp smell and demonstrable antimicrobial activity in laboratory settings. This simple chemical explanation made sense to early practitioners who relied on visible change as evidence. When a patient's wound stopped smelling foul after an application, they inferred that the agent was fighting the invading microbes. Hence, medical manuals and surgeons' notebooks described methods like mashing raw garlic into a paste, mixing it with honey or animal fat to make a dressing, and placing it directly onto wounds or into bandages to keep infections at bay. Resource limitations and the absence of true antibiotics shaped how doctors used the remedy. Topical application was common because it delivered active compounds directly where bacteria proliferated, and because ingesting raw garlic often produced strong gastrointestinal effects that limited dosing. In field and household practice, healers combined crushed garlic with absorbent materials, plant fibers, bread, or lint, and secured them as poultices. They also recommended chewing cloves for respiratory infections or boiling bulbs into broths to inhale vapors for sinus and chest complaints. Surgeons sometimes turned to such antiseptic-sounding measures when no reliable pharmaceutical options existed, and accounts from practitioners mention fewer wound complications when garlic dressings were diligently changed. Physicians' written notes preserved a pattern: repeated empirical trials with the same remedy, incremental refinements in preparation, and candid reporting of limitations. Some observers recorded irritation or burns on sensitive skin after concentrated applications, while others remarked that boiled garlic lost much of its potency. These practical remarks foreshadow modern pharmacology's findings. Heat and processing can destroy or alter active constituents. Today we understand why those early uses occasionally worked and why they sometimes failed, Allicin is effective in vitro against a range of bacteria, but is chemically unstable and is rapidly transformed once ingested or heated. Modern science supports several historical practices while tempering their claims. Laboratory studies confirm antimicrobial effects of garlic extracts and isolated compounds, which helps validate why doctors and lay healers saw apparent benefits when using raw preparations on wounds or as inhalants. At the same time, clinical medicine recognizes that instability, variable dosing, and potential tissue irritation limit garlic's role as a systemic antibiotic substitute. Doctors in earlier eras used it because it was accessible, observable in effect, and modestly effective in certain topical contexts. Today, clinicians might view it as a complementary measure with some evidence for local antimicrobial action, but not as a replacement for proven systemic antibiotics when those are required. How garlic was applied as medicine. Across many regions, people crushed, mashed, or boiled garlic and applied it directly to infected skin or wounds because it reliably changed the course of a sore or ulcer when no chemical antibiotics were available. Crushed cloves were turned into poultices, mixed with animal fat or honey, and spread under dressings to keep grime and microbes from gaining a foothold. The simple medical idea was that the sharp, sulfurous substances released when garlic is broken down could kill or slow the microbes at the surface, so continual topical contact was the main strategy. Healers in household and hospital settings used a surprisingly narrow set of preparations. A common practice was to bruise cloves and place the pulp directly onto lacerations and abscesses, covering the area with clean cloth to hold the garlic in place and encourage its compounds to act on the local infection. For ear pain, oil infused with crushed garlic was warmed and placed as drops to ease presumed infections and blockages. For respiratory complaints, a clove might be chopped into hot broth or inhaled as steam. For toothaches, a tiny piece was lodged against the painful tooth or gum. These treatments were pragmatic and repeated often, because there was no way to sterilize or systemically control infection beyond what the topical remedy achieved. Medical practitioners of earlier eras recorded the remedy's effects in practical terms rather than modern metrics. Texts and surgical manuals note that wounds dressed with garlic compounds sometimes showed reduced putrefaction and less foul discharge, or that soldiers with garlic-treated injuries fared better than those without such care. Barber surgeons and village healers both favored garlic plasters for gangrenous wounds and ulcers, and mothers commonly used crushed garlic in poultices for skin boils. Folk combinations were widespread: garlic plus honey, garlic and wine, or garlic with clay, because these carriers could keep the active juices in place and add their own antimicrobial or absorptive qualities. Modern science explains why many of those early applications often worked for surface problems. When garlic is crushed, it produces allicin and related sulfur compounds that can damage bacterial cell walls and interfere with microbial enzymes. Laboratory studies confirm antimicrobial activity against a range of organisms in vitro. However, the compounds are chemically unstable and their strength varies by preparation. So the concentrated, predictable systemic effects of modern antibiotics are generally stronger and safer for serious infections. Topical use of garlic still has a place for minor skin infections or as a complementary measure, but it can cause irritation or burns and should be used cautiously. The empirical observations of earlier doctors and everyday healers align with what laboratory research now shows. Garlic can fight microbes at a wound site, while also highlighting the limitations that led later medicine to develop standardized antimicrobial drugs. Did garlic really work as antibiotic? Before manufactured antibiotics existed, people turned to strong, readily available remedies, and garlic was one of the most commonly trusted. When a clove is crushed, it releases a sulfur compound called allicin, which acts like a chemical irritant to many microbes by interfering with key proteins they need to survive. In simple medical terms, allicin reacts with enzyme components inside bacteria and fungi, disrupting metabolism and slowing growth. This is why crushed raw garlic can reduce bacterial numbers in a localized area. It is not a single magic pill. Its potency depends on how the garlic is prepared and applied, but it does have real, measurable antimicrobial activity in laboratory tests. Practitioners across many cultures used garlic in straightforward, practical ways that made sense without modern pharmacology. Crushed cloves were spread as poultices onto wounds and ulcers to dry out infected tissue and cut down the foul smell that often accompanies bacterial overgrowth. People also swallowed raw or cooked garlic, brewed simple garlic waters for gargles, and inhaled steam with garlic for chest infections. Physicians and herbalists of antiquity recorded these practices and often noted improvements: less pus, reduced odor, and sometimes faster-looking wound closure. Those observations were based on visible signs rather than bacterial counts, but they guided care when there were no other reliable antiseptics. The absence of systemic antibiotics meant that accessible botanicals became the frontline tools for both home healers and early physicians. Garlic's value was partly situational. It was cheap, easy to carry, and could be applied directly where infection was evident. Field surgeons and domestic healers relied on it because it could lower the local microbial load enough to change the course of an infection in some cases. Yet there were clear limits. The active component forms only when garlic is crushed and is destroyed by heat. Concentration varies by bulb, and topical use can irritate or even burn delicate skin. Infections that invaded deep tissues or the bloodstream could not be controlled reliably with garlic alone. Modern science puts a finer point on those historical experiences. Laboratory studies confirm that allicin and related sulfur compounds can inhibit a range of bacteria, including common wound pathogens, by targeting thiol-containing enzymes. Clinical evidence, however, is mixed. Controlled trials are scarce and results are inconsistent because of variability in preparations and dosing. Today's antibiotics are more potent, stable, and predictable, but garlic's antimicrobial properties explain why it was repeatedly chosen by doctors and laypeople before antibiotics existed. Its historical role was real and pragmatic, sometimes helpful, never a universal cure, and now understood more precisely in terms of chemistry and limits. From kitchen to battlefield, garlic was one of the first go-to infection treatments because people saw it work. Crushed cloves were smeared into wounds, added to poultices, steeped in wine or honey, inhaled as steam, or taken by mouth to calm fevers and reduce pus. Early physicians from Egypt, Greece, Rome, and the Islamic Golden Age recorded in papyri, Hippocratic notes, Pliny, and Avicenna described less swelling and better healing after garlic applications, and everyday healers used it whenever there were no manufactured drugs to reach for. The simple medical reason behind those observations is that garlic releases sulfur compounds like allicin when crushed. These molecules can damage bacterial cells and slow their growth. In a pre-antibiotic world, that burning, pungent action made garlic a plausible and practical antiseptic and systemic remedy, so communities and doctors relied on it by habit and by observation even without knowing about microbes. In short, ancient people used garlic topically and orally. Doctors and healers logged improved wound outcomes, and modern chemistry explains why those effects were possible. Though laboratory studies show allicin can inhibit some bacteria, garlic is not a substitute for prescribed antibiotics in serious infections. It helps explain historical success, but it doesn't replace proven medical treatment today. If this story made you see your kitchen spice rack differently, share a memory of a home remedy in the comments, and hit like if you want more history meets science tales. Next time, we'll follow garlic into the lab to see exactly how researchers test its antimicrobial power and when it might really help. Stay curious.